Again, good morning to everyone. At this juncture, we are about to continue discussing synaptic neurotransmission, particularly on adrenergic synaptic neurotransmission. Recall yesterday, guys, na kapag sinabi nating adrenergic nervous system, we are focusing on the sympathetic, right? On the sympathetic nervous system. And when we talk of sympathetic nervous system, this is related to neurotransmitters called natural catecholamines, di ba? Diniscuss natin to kahapon, the natural catecholamines, in which the principal neurotransmitter sa sympathetic nervous system, that is norepinephrine. And miscellaneous are epinephrine and also dopamine. Okay? In that regard, ipaliwanag na natin on how are these neurotransmitters synthesized, stored, released, and also their fate in the synaptic cleft. Just like yesterday, let me divide this into three parts. That is from pre-synapse, synaptic cleft, and also the post-synapse. So we begin on the synthesis. Okay? Synthesis in the pre-synapse. Again, ang relativity ng topic natin is on natural catecholamines. Paano nasi-synthesize yung tatlong natural catecholamines? Dopamine, epinephrine, and also norepinephrine. So first stop, we have this amino acid, tyrosine. Okay, so we have this amino acid tyrosine that will enter through the transporter that is also sodium dependent. Kaya we can see tyrosine is found already inside the presynapse. Now, what's the importance of tyrosine? Tyrosine, note, is the precursor amino acid. Okay, this is considered as the precursor amino acid in the biosynthesis of catecholamines. When we say precursor amino acid, this tells us na siya ang raw material, the major ingredient that we need for us to produce the three natural catecholamines. Okay? So ano yung unang catalytic reaction na pagdadaanan ni tyrosine? So the first catalytic reaction is via the enzyme tyrosine hydroxylase. Okay? So through tyrosine hydroxylase enzyme, tyrosine is being converted to L-DOPA. Okay? This is being converted to L-DOPA. Okay? So that is via tyrosine hydroxylase. Mind you, class, that tyrosine hydroxylase, this is the rate-limiting enzyme. Okay? This is the rate-limiting enzyme in the biosynthesis of catecholamines. And when we talk of rate-limiting enzyme, that means sa kanya nakadepend kung gaano kabilis o gaano kabagal ang production ng catecholamines. Apparently because siya ang first enzyme that we need in the synthesis of these catecholamines. Okay? So tapos na tayo sa tyrosine hydroxylase. Next, we have the second catalytic reaction, that is L-DOPA would be converted into dopamine. Okay? This will be converted into dopamine via an enzyme ulit, via an enzyme. And that enzyme, although not written here, that is L-DOPA decarboxylase. Again, that is the enzyme L-DOPA decarboxylase. So via L-DOPA decarboxylase, we have dopamine. Okay? And as you can see, sa tatlong natural catecholamines that we keep on mentioning a while ago, the first catecholamine being synthesized is dopamine. Okay? Siya yung unang nagagawa out of the three natural catecholamines. So far, can everyone follow?
Yes, sir.
Yes po.
Okay,
Yes,
sige.
sir.
Yes, sir.
Okay, thank you. So kapag na-form na natin ang dopamine, what happens next? Okay, what happens next? Ang next na step na mangyayari involving dopamine is kailangan siyang ma-store sa vesicle. That's why you can observe in the figure that dopamine will enter into the vesicle, the storage form, right? So the third step is storage. A storage of dopamine. And this is made possible by the transporter called VMAT. Okay? As you can see, this is VMAT. Okay? Ito yung VMAT. And VMAT stands for vesicular monoamine transporter. Okay? Again, this means vesicular monoamine transporter. Okay, vesicular monoamine transporter. So papasok ngayon ang dopamine into the vesicle. Recall yesterday, section 3C, na na-mention natin ang importansya o kahalagahan ng storage process. And that is para maprotektahan ang isang neurotransmitter, right? So in the case of dopamine, the importance of vesicular storage of dopamine is for protection against metabolizing enzymes. Such enzymes are also found in the presynapse, right? So example natin ng metabolizing enzyme in the presynapse that can target dopamine, that is MAO, ay monoamine oxidase. Later, meron tayong designated slide in discussing MAO. Okay? Next, step number 4. Okay, step number 4. Guys, ang step number 4 ay nangyayari sa loob ng vesicle. Okay, again, ang step number 4 ay nangyayari sa loob ng vesicle. Kung i-observe nyo ang figure sa vesicle, ang dopamine, nagulat tayo na naging norepinephrine agad siya. So ano yung specific step na nangyayari inside the vesicle? Bakit ang dopamine ay naging norepinephrine pagpasok? So that is on the fourth step after storage, ang dopamine inside the vesicle is converted to norepinephrine. Okay, this is converted to norepinephrine, of course, via another enzyme. And that enzyme is called dopamine beta hydroxylase. Okay, that is dopamine beta hydroxylase. Again, inside the vesicle, through dopamine beta hydroxylase, dopamine is converted to norepinephrine. Okay? You can see at the end of the fourth step that majority of catecholamine being stored is norepinephrine. That means, kung marami tayong norepinephrine in the vesicle, siya yung majority na i-release eventually. Ay siya yung majority na i-release eventually. Kaya nga siya ang primary neurotransmitter or principal neurotransmitter in the sympathetic nervous system. Okay? So suppose marami tayong norepinephrine in the vesicle. And then you know that calcium is important to facilitate release. Just like yesterday, calcium here will enter through calcium channel, and entry of calcium ions would cause activation of docking proteins like VAMPs and SNAPs that would finally induce the fifth step. And that step involves release process of norepinephrine. Question, what is again the process of release involving neurotransmitters in general?
Exocytosis.
Very good. So the fifth step, that is release through exocytosis. Kaya makikita natin ang norepinephrine from the vesicle has been released. And at the end of the fifth step, makikita natin ang norepinephrine in the synaptic cleft. Okay, nasa synaptic cleft na siya. So in other words, we are done discussing what happens in the presynapse. So let's recall them. Okay, let's recall them. Number 1, sama-sama na to as synthesis, storage, and also release. Number 1, tyrosine to L-DOPA. Next, L-DOPA to dopamine. Number 3, itatago. Importance of pagtatago, protection against enzyme. Number 4, dopamine becomes norepi. And then number 5, release via exocytosis. Okay? Again, connected siya sa mga na-discuss ko sa mga nangyayari sa presynapse. So moving on, proceed tayo sa norepinephrine in the cleft. Can I erase the annotation sa slide na to?
Yes, sir.
Okay, sige, burahin na natin.
Yes, sir.
So imagine natin, guys, nasa synaptic cleft na tayo. Okay, again, nasa synaptic cleft na tayo involving norepinephrine. So with that, let's explain the possible fates of norepinephrine in the cleft. Okay, so ipaliwanag natin ang fates ng norepinephrine in the cleft. Key concept, if norepinephrine is found in the cleft, what's gonna happen to it? Anong pwede mangyari sa kanya? Note everyone na meron tayong four possible outcomes. Okay, meron tayong 4 possible outcomes. Number 1 is through passive diffusion. Okay, number 1 is through passive diffusion. diffusion. Okay, again, number one, that is through passive diffusion. So when we say passive diffusion, this means na ang norepinephrine in the cleft na mataas ang concentration will move along the concentration gradient. That is, magpapass down siya papunta sa ating systemic circulation. Okay, pupunta siya sa ating systemic circulation. So that is passive diffusion. So with this number one fate, ay passive diffusion, I have some questions. Number one, if nagkaroon ng passive diffusion at napunta sa blood circulation natin ang norepinephrine, question, mataas o mababa ang norepinephrine na natira sa ating cleft, high or low?
Low.
Low, very good. Very good, low. So pag mababa ang norepinephrine in the cleft, marami o konti ang available for binding to the receptor?
Low.
Low, very good. So konti ang available for binding. And kapag konti ang available for binding, less or more effect, obviously lesser effect. Kaya ang passive diffusion would lessen sympathetic effect. Okay, would lessen sympathetic effect. Okay, next, number two. Okay, number two, lagyan ko arrow daw na meaning less effect. Okay, less effect. Next, number two, of course, presence of norepinephrine tells us that it can now bind to the postsynaptic receptors. So next, we have binding, okay, binding to postsynaptic receptors. Okay, another fate is binding of norepinephrine molecules into the postsynaptic receptors. Of course, you are knowledgeable about this. When there is enhanced binding to the receptors, this means to say that the impulse, the utos from the utak has been transferred to another site despite of the presence ng gap. Kaya, enhanced effect ang number two. Okay, so enhanced sympathetic effects sa number two. Next, number three, remember as well that in the cleft there are enzymes, right? So you knew that presence of enzymes would mean that there is metabolism, okay, In the case of norepinephrine and other related biogenic amines, we have specialized enzymes that can metabolize them. Okay? We have specialized enzyme. Number one is MAO. So you can search in the internet what does MAO mean, but it's monoamine oxidase. Okay? And aside from that, we have COMT, which means catechol O methyltransferase. So you can also search in the Google what does COMT mean, but it's catechol O methyltransferase. So meron pa tayong other slide that would further explain these enzymes. But in the meantime, just note na kapag na-metabolize ang norepinephrine via this enzyme, of course, ma-inactivate ang norepi, thus lesser amount of norepinephrine will bind to the receptors. So lesser amount of norepinephrine available for binding would signify that there is reduction of sympathetic effect. Okay, so there is reduction of sympathetic effect. Less impulse will reach the target or the effector organ. Kaya lesser effect. Okay, are you learning so far?
Yes,
Sir.
Okay.
Yes po.
Okay, nice. Let me remind you that we have 4 possible fates. So we are down to the last. So for the last, ang norepinephrine and other related catecholamines may undergo the process called reuptake. Okay, so again, nag-undergo ng reuptake process. And reuptake process is made possible by a specialized transporter, and that is called norepinephrine transporter. Okay, again, that is called as norepinephrine transporter, which is also known as uptake, which is also known as uptake 1 transporter, which is also known as uptake 1 transporter. I repeat, the fourth possible fate involving norepinephrine is the reuptake process, and that is held by the transporter norepinephrine transporter, also known as uptake 1 transporter. So at this point, i-explain natin ang reuptake process kasi may effect din siya sa impulse transmission kapag siya ay nangyayari. Okay? So ano bang ibig sabihin natin ng reuptake process. So para maintindihan ito, i-break down natin yung term. Pag sinabi nating pag sinabi nating or that means again. Okay, again, ulit, parang ganon. Okay? Uptake means kukunin. Overall, pag sinabing reuptake, kukunin ulit. Okay, kukunin ulit. Nangyayari ang reuptake in the cleft at from the cleft, ang norepinephrine ay babalik sa presynapse. Okay, again, ang norepinephrine from the cleft babalik sa presynapse. So it goes this way. Kindly check the figure. Again, kindly check the figure. You can see that in the presynapse, we have NET, the norepinephrine transporter. So when we say reuptake, ang norepinephrine, in some cases, ang norepinephrine in the cleft, bumabalik siya sa presynapse via the transporter NET or uptake 1. And once bumalik, nai-store siya ulit sa vesicle. Okay, nai-store siya ulit sa vesicle. So with that being said, anong implication niyan? Pag bumalik ang norepinephrine via NET, parang nawawales, nalilinis, nawawipe out ang norepinephrine sa cleft. So pag nalinis mo siya, bababa ang norepinephrine sa cleft. Okay, bababa siya. Now, I have a question. Pag bumababa ang norepinephrine due to reuptake, lesser ang available for binding? Yes or no?
Yes.
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 Okay, very good. And then, if lesser ang amount would be available for binding, can you tell me what is the ultimate effect due to reuptake? Enhanced or reduced sympathetic effect?
Reduce.
Okay, very good. So,
Reduce.
reduction of sympathetic effect. Very good. So, ang nangyayari sa reuptake, there is a lesser extent of sympathetic effect. Kasi, napipigilan niya ang impulse transmission. Okay? So, these are the fates of norepinephrine in the cleft. So, these are natural. Okay? Natural events na nangyayari. Okay? So, natapos na tayo sa fates in the cleft. We have passive diffusion, binding, metabolism, and reuptake. Please note the implication if enhanced or reduced. Okay? So next, continue tayo. Since ang natitirang part na lang is the post-synapse, again, ang natitirang part na lang is the post-synapse, mag-specify tayo ng info sa post-synapse. Remember, once norepinephrine is present in the cleft, it could bind to the receptor. Now, mind you na meron tayong portion, some portions of norepinephrine can target a specialized effector cell, and that is the adrenal medulla. Okay, that is the adrenal medulla. So some portions of norepinephrine could reach the adrenal medulla, that is an adrenal gland, right? And once some norepinephrine reach the adrenal medulla, chances are this could be catalyzed by an enzyme exclusively found in this area. So merong specialized enzyme na makikita sa adrenal medulla. And that is the enzyme called PENMT. Okay, so that is the enzyme called PENMT, P-E-N-M-T. So that means phenylethanolamine and methyltransferase. So para in the interest of time, okay, in the interest of time, you can search by yourself sa Google kung ano meaning ng mga abbreviations na yan. Okay? But basically, that is an enzyme present in the adrenal medulla. So what does PENMT do? Ang PENMT, it is responsible in converting norepinephrine to epinephrine. Okay? So it is the one responsible in converting norepinephrine to epinephrine. That's why, if ever you could still remember kahapon, majority ng epinephrine nakastore where? Sa adrenal medulla. Okay? Sa adrenal medulla. Kasi doon siya nasa-synthesize talaga. So that's it. That is the process of synaptic transmission for adrenergic neurotransmitters. So you can see na na-discuss natin ang dopamine, ang norepinephrine, and finally epinephrine. Overall, that ends adrenergic transmission. Okay? Adrenergic transmission. So recap tayo, na-discuss natin ang mga steps in the biosynthesis, and then storage and also release, and also the fates in the cleft, and for the production of epinephrine in the adrenal medulla. Naintindihan po ba?
Yes, sir.
Okay, sige.
Yes po.
So right now, let's associate drugs here. So remember, drugs can modify functions. So kindly note that there are agents available in the market that can actually target adrenergic transmission. So maintindihan natin to kung nag-gets ang discussion kanina. Number one, for the drugs, number one, we have metyrosine. The first drug is metyrosine. Metyrosine blocks the enzyme tyrosine hydroxylase. Okay, so it blocks the enzyme tyrosine hydroxylase. And blockade of tyrosine hydroxylase would signify that the biosynthesis of catecholamines would be inhibited already. So block na siya. And pag napigilan yon, walang storage, walang release. Question, when you use metyrosine, what will happen? Less or more sympathetic effect?
Less.
Okay,
Less.
less. Kaya
Less.
siya ay anti-sympathetic drug. Okay, so anti-sympathetic drug siya. Opposer siya ng transmission. Okay? Next, number two is reserpine. So another agent is reserpine. Reserpine naman can block VMAT. Okay, it can block VMAT. And blockade of VMAT would also tell us na ang storage would be inhibited. And storage, as you remember, is important for the protection. Kaya presence of reserpine would expose dopamine from the enzyme, thus enhancing dopamine's metabolism. Kaya ultimately, gaano or ano ang mangyayari sa norepinephrine when you use reserpine? Enhanced or reduced? Okay, reduced. Very good. Kaya ultimately, konti ang i-exocytose, konti ang magbabind, anti-effect siya. Okay, anti-effect. Next, number three, doon naman tayo sa nagtatarget ng exocytosis or release. Number three, we have inhibitors of exocytosis. Inhibitors of exocytosis. There are actually three examples. Number one is beryllium. Number two is guanethidine. And pakidagdag, guanadrel. Another example is guanadrel. So the inhibitors of release are guanethidine, guanadrel, and also beryllium. Apparently, blockade of exocytosis means less would be available for binding, kaya ang mga ito ay anti-sympathetic drugs as well. Okay, so anti-sympathetic drugs. So that's it. Next, number four. Okay, number four, sa exocytosis pa rin tayo, although walang arrow na nakapresent, dagdagan natin. So we also have stimulators of exocytosis. Okay, stimulators. So like we can draw a positive sign here. Okay, positive sign. Before we enumerate the examples, you can actually understand this because kapag stimulator, more will be available for binding, greater sympathetic effect. Kaya ang mga stimulators of exocytosis, they are pro-sympathetics. Pro-sympathetics. Examples, again, examples. Palatandaan natin is T. T. Habaan nyo yung pronunciation kasi maraming A. Ay maraming A dyan. So T. So examples, we have tyramine. Another is ephedrine. Another example is ephedrine. Also, we have amphetamine. Again, another we have amphetamine. Another is angiotensin 2. So dito ko na lang susulat, angiotensin 2 or angiotensin 2. And finally, we have alpha latrotoxin. Again, for those agents that can enhance exocytosis, these are tyramine, ephedrine, amphetamine, angiotensin 2, and alpha-latrotoxin. These are pro-sympathetic agents. Overall, these are the drugs that can alter exocytosis. We have those inhibitors and those stimulators. Next, number 5. Proceed tayo sa number 5. So for the fifth agent or agents that can alter synaptic neurotransmission sa adrenergic, these are cocaine, and also tricyclic antidepressants. In other words, these are so-called as reuptake inhibitors or RIs. Again, number 5, we have the reuptake inhibitors. I repeat, examples are cocaine and also tricyclic antidepressants. Ano naman ang function ng reuptake inhibitors? Reuptake inhibitors they can block norepinephrine transporter. Okay, they can block norepinephrine transporter. As you previously realized, ang norepinephrine transporter is responsible para bumalik ang norepinephrine in the presynapse, in the presynapse. So by blocking norepinephrine, there's no way to go. Ibig sabihin, wala nang ibang way para ibalik, kaya nako-concentrate lalo ang norepinephrine in the cleft. So tumataas ang norepinephrine in the cleft with the use of reuptake inhibitors. Question, if greater norepinephrine is being observed in the cleft, do you think there is greater amount available for binding?
Yes.
Yes, okay. So greater amount will be available for binding. Therefore, pag gumamit ka ng reuptake inhibitor, there is enhanced sympathetic effect. Kaya pro-agents sila. Okay? Kaya pro-sympathetic agents sila. Okay? So taken all together, these are the drugs that can alter synaptic neurotransmission of the sympathetic nervous system. Going back, we have metyrosine, reserpine, we also have inhibitors and stimulators of exocytosis, and finally, reuptake inhibitors. Ang takeaway nyo dito is alamin kung enhance or reduce effect sila. Okay? Kung enhance or reduce effect. Pwede na tayo mag-proceed sa next. Okay, sige. So proceed na tayo. After finishing synaptic neurotransmission, mag-focus tayo sa biosynthesis and metabolism of catecholamines. Although, na-discuss ko na siya previously, i-reinforce lang natin. Ito yung binanggit ko kanina. In the biosynthesis, the precursor amino acid is tyrosine. Via tyrosine hydroxylase, we have L-DOPA or DOPA. And then via L-DOPA decarboxylase, ang L-DOPA decarboxylase is related to aromatic L-amino acid decarboxylase. So in short, ang tandaan nyo na lang yung sinabi ko kanina. Okay? Yung L-DOPA decarboxylase. And then it becomes dopamine. And sa loob ng vesicle, dopamine is converted to norepinephrine. And I told you, may portion ng norepinephrine converted to epinephrine because of the enzyme PEN-MT. Ito yung ibig sabihin ng PEN-MT. Okay? Phenylethanolamin and methyltransferase. Next, what about sa metabolism? Ano yung dalawang enzymes responsible for metabolism? I discussed, these are MAO and also COMT. Okay? Regarding metabolism of norepinephrine and epinephrine, note everyone that we have the same ultimate metabolite. Ang ultimate, ang tandaan nyo na lang sa right side ha, yung ultimate metabolite, yung final product ng metabolism involving norepinephrine and epinephrine. So this is called VMA. So that is 3-methoxy-4-hydroxymandelic acid. Okay, so again, that is 3-methoxy-4-hydroxymandelic acid. And often, this is called as VMA. And when we say VMA, this stands for vanillyl mandelic acid. Okay, this stands for vanillyl mandelic acid. Synonymous lang sila. So for norepinephrine and epinephrine, we have the degradation product, 3-methoxy-4-hydroxymandelic acid or VMA. Now, as you remember, we have 3 catecholamines, naturally occurring catecholamines, right? Ang wala na lang is dopamine. In the case of dopamine, I repeat, in the case of dopamine, we also have MAO and COMT as responsible enzymes. However, yung ultimate product of metabolism ay iba compared sa norepinephrine and epinephrine. Dito ang pangalan ng product of metabolism ay homovanillic acid. I repeat, the name of the degradation product for dopamine, that is homovanillic acid. So that's it on metabolism. Okay na tayo sa biosynthesis and also metabolism. And overall, that marks the end of synaptic neurotransmission both for cholinergic and also adrenergic nervous systems. Naintindihan ba ang ating lecture so far?
Yes, sir.
Yes po.
Yes, sir.
Wait lang ah. Okay, moving on. So thank you for your patience and also dedication to learn. So moving on, let's proceed to different receptors. So para may idea tayo sa susunod na part ng lecture, ang i-discuss natin ay receptors. Remember, saan ba natin makikita majority ng receptors? Is it sa pre or sa post synapse?
Post
Very
Synapse.
good.
Post
Very good.
synapse po.
So we can see majority of the receptors in the post synapse. And take note, ang post synapse having receptors could mean in the effector organs, in the effector organs. So in other words, ang pag-uusapan natin dito na receptors ay yung mga receptors na nasa effector organs. What's the importance of telling you this? Effectors are the organs being tasked by our brain to adjust. So dito natin makikita ang epekto ng utos ng utak sa mismong organ, having the receptor. And also remember that binding of neurotransmitter like acetylcholine and also norepinephrine is essential para maramdaman sa effector yung utos ng utak. Okay? So dalawang parts ang i-discuss natin dito. Number one is sa adrenergic receptors and later sa cholinergic. And when we talk of adrenergic receptors, we have the alpha receptors and also the beta receptors as majority. Okay? As majority. Kaya ang possible takeaway nyo dito guys, dapat maintindihan nyo yung nangyayari sa isang organ pag na-target ng norepinephrine ang alpha at beta. So yun yung ating takeaway. Okay? So i-discuss natin isa-isa. Let's start with alpha receptors. So regarding alpha receptors, we have two major types of alpha receptors. These are alpha-1 and also alpha-2 receptors. I repeat, we have alpha-1 and alpha-2 receptors. Regarding alpha-1 receptors, these receptors are post-synaptically located. Lahat ng alpha-1 receptors ay post-synaptically located. Okay? Whereas ang alpha-2 receptors naman, meron tayong presynaptic alpha-2 receptors, meron tayong presynaptically located, pero ano siya, makikita sa brain or centrally located, and then meron din naman na post-synaptically located. Okay, we have the presynaptically located alpha-2 and post-synaptic. I repeat, makikita natin ang presynaptic sa utak or sa CNS at ang post-synaptic sa blood vessels, okay, peripheral blood vessels. So we can see this in the peripheral blood vessels. Okay, so we can see this in the peripheral blood vessels. For alpha-1 receptors, these are found in the different smooth muscles. Ay makikita natin siya sa iba't ibang mga smooth muscles. And bottom line, ang effect ng alpha-1 sa mga smooth muscles ay contraction. Kaya ang effect sa mga smooth muscles ng alpha-1 ay contraction. So don't worry, mamaya mare-reinforce yung general concept na to. Okay? I-discuss natin siya isa-isa. So these are the types of alpha receptors. That's why in the figure, you can see that naka-indicate dyan na ang alpha-1 receptors ay post-synaptically located. Kaya meron tayo ditong alpha-1 sa post-synapse. And then ang alpha-2 receptors naman ay makikita, number 1, sa pre-synapse, that is sa utak natin, Okay, number 1 sa utak natin. And hindi man nakapresent dito, pero meron din tayong postsynaptic alpha-2 sa blood vessels. Okay, sa blood vessels. So that is the alpha-2 receptor. Regarding presynaptic alpha-2 receptors, I repeat, regarding presynaptic alpha-2 receptors, since this is presynaptically located, ang effect niya, tandaan, ang effect niya ay inhibitory. Okay, ang effect niya ay inhibitory. Inhibitory, ibig sabihin, siya ay pampigil ng usual sympathetic effect. Okay, siya ay taga-block ng usual sympathetic effect or taga-control, okay, ng usual sympathetic effect. Kaya mababasa nyo sa slide, naka-indicate naman dyan, inhibit further release of neurotransmitter like norepinephrine. In Tagalog, pinipigilan ng presynaptic alpha-2 ang paglabas ng norepinephrine. Hindi ba pag napigilan ang labas, mababa ang sa cleft? Pag mababa ang makikita sa cleft, what do you think? Lesser ba ang available for binding?
Yes.
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 Kaya siya inhibitory. Very good. Kaya siya inhibitory. Okay? Siya yung pang-control. So that is for presynaptic alpha-2 receptors. Now, paano naman ang alpha-1 receptors? Anong sabi ko sa alpha-1? Ano ang generalized effect ng alpha-1? Contract or relax? Contract. Very good. So ano ang mga target sites sa katawan ng alpha-1 or saan natin siya makikita usually? Sabi natin sa smooth muscles. Ano-ano ba yung mga examples natin ng mga smooth muscles? So number 1, sa blood vessels. Okay, number 1, sa ugat or sa blood vessels. So when there is activation of alpha-1 in the blood vessels, anong sabi natin kahapon? There is vasoconstriction. And when there is vasoconstriction, mataas o mababa ang pressure sa ating ugat pag may vasoconstriction or contraction?
Mataas.
Mataas. So faster blood movement, remember? Kahapon, so faster blood movement. And pag mataas ang pressure, tataas ang blood pressure. Okay, tataas ang blood pressure. Okay, so that is for blood vessels. Next, meron din tayong alpha-1 receptor sa ating mata, particularly sa radial smooth muscles. Okay, again, particularly sa radial smooth muscles ng ating iris. So sa iris ng mata ito makikita. Again, alpha-1 receptors could be found also in the radial smooth muscles of the iris. Ang iris natin, ito yung larger black or brown na bilog sa mata, okay? And then ang smaller version inside of the black is pupil. So yung iris itong malaki na to, okay? Yung nasa mata natin. Now, may radial smooth muscles dyan. Ano ba ang function ng radial smooth muscles? Ang radial smooth muscles, these are muscles in the iris that push away, okay? So these are specialized muscles that push away the iris. So ibig sabihin, siya ang nagpapaliit ng size ng iris natin, especially when contracted. So pag na-activate ang alpha-1 receptors in the radial smooth muscles of the iris, there is contraction of it. So anong ibig sabihin pa nag-contract ang radial muscles? Lumiliit ang iris natin. Okay, lumiliit ang iris natin. O ano ngayon pag lumiit ang iris? Tandaan, pag lumiit yung iris natin sa mata, that indicates na yung smaller inside lumalaki. Ano ba yung smaller structure natin sa loob ng iris? Pupil. Very good, pupil. So in short, pag lumiliit ang size ng iris, lumalaki yung pupil. O ano yon pag lumalaki ang pupil? Mydriasis or meiosis?
Mydriasis.
Okay. Kaya may mydriasis. Okay, kaya merong mydriasis. Do you understand this? Naintindihan?
Yes po.
Okay, so very good. Moving forward, meron din tayong alpha-1 receptors in the bladder, trigone, and sphincter, or particularly in the urinary sphincter. Okay, so in the sphincter ng ating urinary bladder. So ang sphincter, siya yung nag-open or nagko-close kapag may certain effects sa ating katawan. Particularly, Pag na-activate ang alpha-1 receptors due to contraction of the sphincter, there is closure of the sphincter. Sarado yung sphincter. Question, pag sarado ang sphincter, ang ihi ba ay mailalabas o mare-retain?
Retain.
Okay, very good. Sarado kasi so may retention of urine. Kaya ang effect dito ay urinary retention. Okay, urinary retention. So this is the effect in the bladder, trigone, and sphincter, urinary retention. Guys, so far, you can actually observe na yung mga effects na dinidiscuss natin ay nagre-reflect sa table na pinakita ko kahapon. Di ba diniscuss ko to in general? So nadedetect nyo dito kung anong receptor ang responsible for the sympathetic effect. So, nai-specify na natin siya. Okay, nai-specify. Next, alpha-1 pa rin. Foundation to ng pharmacology are receptor effects, kaya you have to study this. So, next, dagdagan natin yung alpha-1 receptors. Sa mga lalaki, meron tayong additional alpha-1 receptors in the prostate gland. Okay, sa prostate gland. Pakidagdag ito, in males, meron tayong additional alpha-1 receptors in the prostate gland or in the prostatic smooth muscles. Sulat muna natin yung effect. Di ba ang ating guide? Ano yung guide natin pag alpha-1? Basta contract. Alpha-1, contract, contract, contract. Alamin nyo na lang kung saang parte ng katawan. So dito sa prostate gland, nagko-contract ang prostatic smooth muscles. Pero ang tanong, anong impact nito? Anong impact nito sa lalaki? Para maintindihan natin, i-locate natin first ang prostate gland. Saan ba siya makikita? Ang prostate gland sa lalaki ay makikita na nakapalibot, ito ay nakasurround sa urinary tract. For example, this represents the urinary tract of male, and then the one that surrounds it, itong pabilog na to, is the prostate gland. Okay, so halimbawa, ito yung prostate gland. Apparently, yung tract na nakikita nyo dyan is yung daanan ng ihi. Okay, daanan ng ihi palabas. Now, when there is alpha-1 activation in the prostate gland, there is contraction. And when we say contraction, this means that the prostate gland creates puwersa, it creates force towards the center, papuntang gitna. So napupush ng prostate gland yung urinary tract towards the center. Question, kapag na-push siya towards the center, how's the diameter or how's the daanan of the ihi pag nag-contract ang prostate gland? Luluwag or sisikip? Okay, very good, sisikip. So kaya pag sisikip, how's the movement of urine? Less or more?
Less.
Yes, kaya ang effect kapag nag-contract ang prostate gland in males, is it urinary retention or urination?
Retention.
Okay, very good. So there is urinary retention as well. Okay, so meron ding urinary retention. So with this information, ano yung take-away knowledge nyo? Siguro narinig nyo na kahit papaano ang sakit ng lalaki na prostate gland enlargement, di ba? Minsan, ang mga lalaki, usually yung mga elderly male patients, they have or they experience prostate enlargement. So isang simptomas ng prostate enlargement, hirap umihi. Ito yung feeling na may urgency ka na sa urination. Yung feeling mo, di ba pag ihi ka na, iba yung trajectory ng ihi eh. Iba yung talsik ng ihi pag ihi ka na. Pero sa mga lalaki may prostate enlargement, kahit feeling nila ganun dapat ang paglabas ng ihi, ang baba ng ihi, parang bumabagsak lang siyang ganyan. Kasi nga, pigil yung labas. Okay? Merong retention kasi. Yung parang may naiwan. Ramdam mo yun pag may naiwan na ihi sa'yo, di ba? So something like that. Naintindihan po ba sa prostate gland?
Yes po.
Okay,
Yes,
very
sir.
good. And then, isa pang effect ng alpha-1, bali pang 5 na tayo. Panlimang effect aside sa prostate gland, meron din sa pilomotor smooth muscles. Okay, so meron din sa pilomotor smooth muscles. So in the pilomotor smooth muscles, we have the effect called piloerection. Again, in the pilomotor smooth muscles, we have the effect called piloerection. And piloerection simply means goosebumps. Okay? So this simply means goosebumps. Alpha-1 mediated din siya. or pangingilabot. So these are the effects of alpha-1 receptor activation pag na-activate. Pag nag-bind ang norepinephrine, for example, sa alpha-1. So ito yung mangyayari sa mga effectors. Vasoconstriction, mydriasis, urinary retention, and goosebumps. Naintindihan po ba?
Yes po.
Okay. And then this figure explains the effect of alpha-1 in the blood vessels. So activation of alpha-1 would cause vasoconstriction. I told you when there is vasoconstriction, that causes an increase in blood pressure. Okay? So that causes an increase in blood pressure. So that's it. So everyone, we are finished discussing alpha-1 receptors. Tapos na tayo sa alpha-1. Moving forward are the alpha-2 receptors, particularly presynaptic alpha-2. Actually, na-discuss ko na to. Once activated, ang presynaptic alpha-2 in the brain or in the CNS, by the way, ang specific area sa ating utak na may alpha-2 ay vasomotor center, of the brain. Again, that is the vasomotor center of the brain. Such activation would inhibit further release of norepinephrine. Take note, guys, ang tawag natin sa ganitong process, yung inhibits further release of norepinephrine, that is the process called autoregulation. Again, that is the process called autoregulation. So the process is called autoregulation. So we explained a while ago that inhibition of further release would lessen the amount of norepinephrine in the cleft. Thus, lesser will be available for binding to the receptors. Kaya ang presynaptic alpha-2 ay inhibitory receptor. Ay inhibitory siya. Now, because of autoregulation, ano ang pwedeng mangyari? Kaya ano ang pwedeng mangyari? So number one, in the brain, ang effects are sedation and also depression. Again, in the brain, the effects are sedation and also depression. Kaya ang effect nito sa tao ay depressant effect or inaantok. And then in the periphery, that is in the blood vessel, the effect of autoregulation is vasodilation. Okay, again, ang effect in the periphery is vasodilation, and vasodilation would result to lessening of blood pressure or lowering of blood pressure. I repeat, in the blood vessel, there's vasodilation, thus lowering blood pressure. So these are the consequences of autoregulation. I reiterate, we have in the central part and in the peripheral part, sedation and depression and vasodilation respectively. Okay? And for alpha-2 receptor activation, ito na yung sinabi kong autoregulation. Okay? Ito na yung sinabi kong autoregulation sa left side. Yung inhibits further release of norepinephrine. Okay? And then, meron ding effect ang alpha-2 receptors which are presynaptic in the pancreatic beta cells. Recall, class, that pancreatic beta cells are the ones that synthesize and also release insulin. Okay, di ba? Sila ang nag-i-store, nagsisynthesize, nag-i-store at nagre-release ng insulin. The effect of alpha-2 presynaptic here is inhibition of insulin release. Major inhibitor ng release ang alpha-2 activation. That is presynaptic alpha-2. So question, pag na-inhibit ang insulin release, ang effect is what? Hypo o hyperglycemia?
Hypo.
Hypo, sir.
I repeat, what's the effect?
Hypo.
Hypo.
Okay, so balikan natin. Ang insulin ay hypoglycemic hormone. So pag na-secrete siya ng ating pancreas at napunta sa dugo, it lowers blood sugar. Ang effect ng presynaptic alpha-2, pinipigilan niya yung pagpunta sa dugo ng insulin na i-store sa pancreas lang. Oh, what's the effect in the blood sugar? Less or more? Yes, so
More.
the effect is hyperglycemia. So I repeat, the effect is hyperglycemia. Okay? So yan ang effect ng alpha-2 receptors. Guys, this figure naman explains the clinical applications of alpha or of drugs that can target alpha receptors. Okay? So remember, we have alpha-1 and alpha-2 receptors. So para maintindihan ang figure na to, i-connect natin ang mga effects kanina sa mga drugs. Okay, sa mga drugs. So number one, sa alpha-1 receptors, remember, ang effect ng alpha-1 ay contraction in general. Okay, contraction. Question, kung meron tayong gamot na mag-activate ng alpha-1, syempre yung gamot na pinepertain natin ay isang constrictor drug kasi ina-activate niya, sinusuportahan niya. Okay? Now, paano naman pag ang gamot ay nagbablock ng alpha-1 receptors? Anong realization natin? Yung gamot ba ay isang constrictor agent or dilator agent kapag binablock ang alpha-1?
Dilator.
Okay, dilator or relaxant siya. So parang ganon ang magiging game dito. Okay? So una, we have agonists. Agonists are stimulants of alpha-1 receptors. So ang mga agonists therefore ay constrictors. Usually kapag constrictors sila, they can be used as decongestants. Okay? They can be used as decongestants. And other applications will be discussed sa next PowerPoint presentation natin. And then for alpha-1 blockers, since they are, based on your answers, since they are dilators or relaxants, one of their effects is by relaxing the blood vessels. And relaxing blood vessels would make us realize that lesser pressure is being observed. Kaya, pag ang isang gamot ay alpha-1 blocker, chances are anti-hypertensive siya. Okay? Anti-hypertensive. Do you get this? Naintindihan?
Yes,
Yes
sir.
po.
Okay. Listen. What about sa benign prostatic hyperplasia? Ang benign prostatic hyperplasia ay prostate enlargement. Prostate enlargement. Question, based on what I have discussed so far, do you think may clinical value, may magandang effect ba sa clinical setting pag gumamit tayo ng gamot na nagbablock ng alpha-1 sa taong may BPH?
Yes.
Yes, meron. Kasi pag na-relax or pag na-block natin ang alpha-1 receptors, relaxed ang ating prostate gland at pag relax siya, konti o maraming ihi ang ilalabas ng lalaki.
Marami.
Marami na, very good. Kaya pag nabasa nyo ang indication or clinical use ng alpha-1 blocker, nakalagay doon, symptomatic relief of urinary retention. So ibig sabihin, pampatanggal siya ng simptomas na hirap umihi pag may BPH. O di ba connected siya doon sa diniscuss natin? I hope you are learning with this. Okay? Next, alpha-2 naman, kay alpha-2. So on alpha-2 receptors, we have alpha-2 agonists and also alpha-2 antagonists or blockers. Regarding alpha-2 agonists, particularly alpha-2 presynaptic agonist. Pag pinag-usapan natin ang presynaptic agonist, meaning sinusuportahan nila yung diniscuss natin kaninang autoregulation. Okay? Sinusuportahan nila ito. Remember, isang effect ng autoregulation is what? That is vasodilation. At pag may vasodilation, ano nangyayari sa ating blood pressure? Tumataas or bumababa? Bumababa. Kaya pag chinek, yes, very good. Kaya pag chinek nyo yung figure, ano ang clinical value? Ano ang clinical value ng alpha-2 agonist? Pang-hypertension din sila. Okay? Pang-hypertension. So yun yung connection niya. Okay? Kaya lang, ang common side effect ng mga gamot na alpha-2 agonist, nakakaantok. Karamihan ng mga pasyente na umiinom nito, inaantok sila. Kasi ano yung isang effect? That is sedation. Okay? Sedation. So connected siya. Next, ang alpha-2 blocker naman, ito less likely observed in the clinical setting. Example is yohimbine. Ang clinical use ng yohimbine is for erectile dysfunction. Okay, so that is for erectile dysfunction or ED. Pero less commonly used siya compared sa ibang mga erectogenic drugs. Pwede na po tayo mag-continue? Ha?
Yes, sir.
Okay, sige. So everyone, we are finished discussing alpha receptors. Recall, dalawa lang sila, alpha 1 and alpha 2. Next, adrenergic receptors pa rin guys. Let us have beta receptors. Sa beta receptors naman, we have beta 1, beta 2, and beta 3 receptors. Again, we have beta 1, beta 2, and beta 3. So isa-isayin natin sila, starting off with beta 1. Dalawa ang major organs that possess beta 1 receptors. Number one is the heart. Okay, number one is the heart. And second are the kidneys. Okay, second are the kidneys. So I repeat, we have the heart and also the kidneys. In the heart, again, in the heart, makikita natin often ang beta 1 receptors in the ventricles of the heart. Okay, so makikita natin to usually sa ventricles of the heart. So ano ang mga effects ng beta 1 activation in the heart? So meron tayong tatlong major effects in the heart. Number one is increase chronotropy. Okay, so that is increase chronotropy. Number 2 is increase inotropy. Okay? Next, number 2 is increase inotropy. Dito muna tayo mag-focus right now before we proceed on the third one. First is increase chronotropy. Chronotropy is a medical term pertaining to heart rate. Okay? So this is a medical term pertaining to heart rate. In Tagalog, bilis ng tibok ng puso. Okay? Bilis ng tibok ng puso. So when beta 1 receptors are activated in the heart, there is increased rate of contraction. Bibilis ang tibok ng puso. Lub-dub, 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 lub-dub. Mabilis. Okay? Kapag naman inotropy means force of contraction. Okay? So this means strength or force of contraction. So when beta 1 is activated in the heart, aside from mabilis, malakas din ang tibok na puso. So kaya, pag na-activate ang beta 1 in the heart, mabilis, heart rate, chronotropy, at malakas ang tibok ng puso, ino or force. So kung kanina, lub-dub, 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 ngayon, lub-dub, 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 lub-dub. So parang ganon. Okay, mabilis siya. Naintindihan?
Yes, sir.
Yes, sir.
Okay, so yan ang beta 1 receptors. Next, yung first two effects. Next, number 3. Yung number 3 naman ay may kinalaman sa medical term in the heart called dromotropy. Okay, so that is called dromotropy. So when we say dromotropy, that means conduction velocity. And that is also related to heart rate. Okay, yung bilis ng tibok ng puso. So overall, ang effect in the heart, tatlo lang. Okay, tatlo. Positive, pag sinabing positive, enhanced din yon or increased. Positive ino, positive chrono, and positive dromo. Okay, so that's it for beta 1. Now, i-connect natin sa clinical setting, clinical value. Guys, pag meron tayong gamot, say for instance, pag meron tayong gamot that can activate beta 1, what do you think? Is that drug a cardiac stimulant or cardiac depressant?
Stimulant.
Very good, stimulant. Kaya pag nag-discuss ako later na mga specific drug names na beta 1 agonists are stimulants sa agonist, they are cardiac stimulants. Pinapalakas nila at pinabibilis ang tibok ng puso. Familiar ba kayo sa beta blockers?
Opo.
Yung mga olol, yes. So, ang beta blockers naman, they actually block beta 1 receptors. Kaya, siguro narinig niyo na before, sila ay pampakalma ng puso. Pampakalma sila because they are beta 1 antagonists. They will oppose these heart effects. Everyone, can you follow?
Yes, sir.
Okay.
Yes, sir.
So okay na tayo sa heart, okay? Okay na tayo sa puso. Next, meron din beta 1 receptor sa ating kidneys, kidneys. In particular, we can observe beta 1 receptors in the kidneys in the juxtaglomerular cells. Juxtaglomerular cells. Ang juxtaglomerular cells, they store a specialized enzyme. And that is the enzyme called renin. Okay, that is the enzyme called renin. Now, marami tayong possible triggers para maglabas ng renin ang juxtaglomerular cells. Marami tayong mga possible stimuli or dahilan para maglabas ang juxtaglomerular cells ng renin. At isa doon ang beta-1 activation. Okay? Isa doon ang beta-1 activation. So through beta-1 activation, renin will be released. Question, ano ngayon ang kwenta pag nailabas ang renin sa ating sistema? Okay? Pag nailabas siya. When renin is secreted by the juxtaglomerular cells, there is a pathway na pagdadaanan ng renin. Okay? I-discuss natin yung pathway na yon sa cardiovascular pharmacology. So ngayon, superficial lang muna. Kapag na-secrete ang renin, tataas ang synthesis ng angiotensin 2. Ito muna yung tandaan nyo. Okay? Madidiscuss natin siya sa cardiovascular. I-shortcut muna natin in the meantime. So kapag tumaas ang renin, that causes an enhanced concentration of angiotensin 2. Remember, again guys, remember, ang isang gamot or substance that can enhance exocytosis is angiotensin 2. So ang effect niyan is pag marami tayong angiotensin 2, greater sympathetic effect causing increased blood pressure. Okay? Causing an increase in blood pressure. So yan ang effect ng renin. Dumarami ang angiotensin 2, increasing BP. So taken all together, tapos na po tayo sa beta-1 receptors. Okay? Take note, heart and kidneys. Next, can we erase this part?
Yes.
Yes po.
Okay, sige. Next, beta-2 receptors. Medyo heavy ha, pero tiyaga lang, makakaraos din tayo. For beta-2 receptors, meron tayo mga specific locations ng beta-2 receptors. So number 1, in the smooth muscles. And number 1, in the smooth muscles. Well, in fact, yung dalawang nakapresent dyan na areas ay parehas sa smooth muscles. Okay? Smooth muscles. At ang palatandaan sa smooth muscles, ang effect in general ay relaxation. Okay? Relaxation. Number 1, we have beta-2 in the bronchi, bronchial smooth muscles. And since ang ating clue ay relaxation, ang effect ay bronchodilation. Okay? Bronchodilation. Next, in the uterine smooth muscles naman, again, in the uterine smooth muscles naman, the effect is uterine relaxation as well, and that is medically called as tocolysis. Okay? That is medically called as tocolysis. Okay? What else? Smooth muscles pa rin everyone, smooth muscles. Meron din tayong effect or meron ding beta-2 receptor effects in the blood vessels of the skeletal muscles. Okay, blood vessels of the skeletal muscles. At ang effect, guys, sa skeletal muscle blood vessels ay vasodilation. Again, the effect is vasodilation. Again, in the smooth muscles, ang general effect ay relaxation, such as in the bronchi, in the uterine smooth muscles, and also in the skeletal muscle blood vessels. Okay? Continue natin. Beta-2 pa rin. Pakidagdag, meron pa tayong other effects involving beta-2 activation. Okay? Meron pa tayong other effects. Such as, number 1, skeletal muscle contraction leading to tremors. Okay? Leading to tremors. And because of beta-2 activation, another effect is also hypokalemia. Hypokalemia. Again, other effects brought about by beta-2 receptors are tremors and also hypokalemia. And when we talk of hypokalemia, there is less potassium, less potassium in the blood. So yan po ang beta-2 receptors. Guys, nakikinig pa? O ilan to? Ilan tong nasa video ko, yung daliri ko, ilan?
Isa po.
Isa. O
Isa po.
nakikinig pa. Very good. Anyway, review tayo. Review. So sa beta 2, para ma-appreciate nyo ang pharmacology dito, syempre, may gamot tayo na nagta-target ng beta 2 receptors and therefore may clinical value. Una, kapag may gamot na nag-activate, again, pag may gamot na nag-activate ng beta 2 receptor, ibig sabihin, ang gamot na yon ay bronchodilator. Bronchodilator. At pag bronchodilator siya, meron ba siyang pakinabang sa mga taong hirap huminga? Halimbawa, may asthma.
Yes
Yes.
po.
Yes.
Po.
Kaya may mga gamot na anti-asthmatic na ang pangalan beta 2 agonist. Okay? So ito yung implication nun. Okay? Next, paano kapag ang gamot ay beta 2 agonist din pero selective sila sa pag-target ng beta 2 sa uterus ng babae? Meron ba siyang clinical value? Yes, meron siyang clinical value. Ang uterine smooth muscle, siya ang responsible paano ko ba i-Englishin yon, pero sa kanya nakastay yung fetus habang nagde-develop siya bago ipanganak yung baby. Now, may mga pagkakataon na nagkakaroon ng premature contraction ang uterus ng babae. So kapag premature contraction, meaning hindi pa husto yung oras pero ini-indicate na i-deliver ang bata ilabas, which is abnormal. Hindi dapat. Kasi kapag hindi husto ang bilang ng buwan at na-deliver ang bata, premature yung baby, di ba? Kaya isang therapeutic goal doon para maiwasan ang premature labor ng babae, pakalmahin, i-relax ang uterus. Kaya gagamit tayo ng beta 2 agonist din. Ang tawag ng mga OB sa mga gamot na to sa babae, pampakapit. Pampakapit. Naririnig nyo ba yung pampakapit sa mga OB?
Yes po.
Yes, okay. Tocolytic ang tawag doon, pampakapit. Kailangan natin siya bigyan ng pampakapit para hindi lumabas yung bata. O parang ganon, okay? So that's for beta 2 receptors. Next, may isa na lang tayong beta receptors na natitira. Dito na lang, maikli lang naman siya, beta 3. Okay, again, last, we have beta 3 receptors. Talking about beta 3 receptors, these are found in the adipocytes. Again, for beta 3 receptors, these are actually found in the adipocytes or in the adipose cells. Ang adipose cells, these are the ones that store triglycerides o yung taba natin. Okay? And pag na-activate ang beta 3 receptors, ang effect is lipolysis. Okay? Again, ang effect is lipolysis or lipolysis. Sa biochem, ang lipolysis, ito yung proseso na kung saan ang ating tag or yung triglyceride ay na-hydrolyze o nababawasan, natatanggal yung triglyceride sa ating adipose para maging free fatty acid. Okay, para maging free fatty acid. So again, lipolysis is the process wherein triglycerides or triacyl glycerols are hydrolyzed into free fatty acids. Sa madaling salita, pag may lipolysis, yung pag-swell ng adipose natin ay napapaliit, nagsishrink siya. Lumiliit ang size ng adipose kasi yung triglyceride natanggal. Okay, natanggal. Question, may clinical impact ba to? May clinical impact ba to kapag ang gamot ay beta 3 agonist? Meron. Anti-obesity agent yung gamot. Okay? Anti-obesity. Kapag agonist ng beta 3. Kasi yung taba na nasa triglycerides tinatanggal. Naintindihan kung ba't anti-obesity ang beta 3 agonist?
Yes, sir.
Okay. So that's
Yes,
Yes
sir.
po.
That's good. Very good, guys. Overall, that's for beta receptors. O recap tayo mga bata, recap tayo. We were able to discuss two adrenergic receptors, the alpha and the beta receptors. Ilang subtypes ng alpha receptors meron tayo? Isa o dalawa?
Dalawa.
Dalawa. Very
Dalawa.
good. Ang beta ilan?
Tatlo.
Okay. Okay, very good. So we
Tatlo.
have tatlo. O, Q&A tayo, Q&A. Ang topic na tatanungin ko is all about alpha. Okay? All about alpha receptors. Choices, 1 or 2. Okay? Pag 1, alpha 1. Pag 2, alpha 2. Are you ready?
Yes, sir.
Okay. First question, general effect is constriction.
1.
Very
One.
good.
One.
1. Next, inhibitory.
2.
2. 2. Inhibitory. Next, autoregulation. 2. 2. Okay. So 2. Next, mydriasis.
1.
1. Urinary retention.
1.
Okay. Vasodilation.
2.
Depression.
2.
2.
Very good. Next, beta receptors naman. Beta receptors. Choices 1, 2, 3. Number 1, treatment of premature labor.
2.
2. 2. Okay, 2. Next, anti-obesity. 3. Very good. 3. Next, heart.
1.
1.
Very good. Bronchodilation.
2.
2.
2.
Anti anti-asthma.
2.
Okay,
2.
very good. Okay nang bahala magkabisa niyan, important siya. Okay, important siya. Next, etong mga figures na to, oh, very good guys. So itong mga figures na to, na-explain ko na siya kanina. Oh, asthma, premature labor, okay na siya. Okay? And then, anong sabi ko? May relaxation din sa non-vascular smooth muscle. Anong sabi natin? Anong klaseng ugat yung sinasabi ko sa beta 2 na may relaxation? Sa smooth muscle ba o sa skeletal muscle?
Skeletal.
Okay, sa skeletal. So, na-discuss na natin siya. Okay? So, everyone, we are finished discussing adrenergic receptors. So, moving on, actually, summary lang siya. Wala kasi ako makita na pinakamagandang summary ng mga cholinergic receptors eh. So, starting from this slide, discuss natin ang cholinergic receptors. Okay, cholinergic. Sa cholinergic receptors of the effector organ, we only have two types, the muscarinic and the nicotinic receptors. First stop sa muscarinic, guys, we have three subtypes. We have muscarinic 1, muscarinic 2, and muscarinic 3 receptors. In short, for muscarinic 1, ang effect ay increased hydrochloric acid secretion. So increased hydrochloric acid secretion tells us that magiging hyperacidic ang stomach pag activated. Okay? So anong reflection nyo dito? Kapag ang gamot ay nagbablock, for example, ng muscarinic 1, pwede ba siyang anti-hyperacidity drug? Yes, okay. So pwede. So ganun yung application pag binlock ang muscarinic 1. Moving on, muscarinic 2. Sa muscarinic 2 receptors, we can find these receptors in the heart as well. Kaya lang ang difference is, ang beta 2, or sorry, ang beta 1 kanina, makikita natin where? In the ventricles, right? In the ventricles. Pero dito, in the atria. Okay? In the atria. In the atria. In the atria. Now, ano ang mangyayari? Ang mangyayari ay negative chrono, negative dromo, at negative ino. In short, kabaliktaran ng beta 1 kanina. Kabaliktaran. Question, pag negative chrono, negative ino, negative dromo, ano ang overall effect? Is it bradycardia or tachycardia? Yes, bradycardia. Very good. So it's bradycardia. Next, muscarinic 3. Guys, ito yung guide natin sa muscarinic 3. Dalawa ang target effectors sa muscarinic 3. Number 1, in the exocrine glands. So unahin natin ang exocrine glands bago tayo mag-check dun sa table. Sa exocrine glands, ang effect ay enhanced secretion. Again, in the exocrine glands, ang effect ay enhanced secretion. So when we say enhanced secretion, ibig sabihin, basa yung effect. Di ba nabanggit natin kahapon, basa ang mangyayari pag parasympathetic. So M3 mediated siya. So ano yung mga examples natin ng mga exocrine glands na basa ang mangyayari? Luha, lacrimal glands, ay yung pagluluha. Ano pa? Paglalaway, salivary glands. So magkakaroon ng salivation. And then, Sweat glands, di ba? Nagsusweat tayo. Recall question. Kapag sa exocrine gland, pag sa sweat gland, is it localized or generalized pag parasympathetic? Yes,
General.
generalized. Very good. Ano siya? Apocrine or eccrine?
Green.
Yes, eccrine. Very good. So, kaya makikita nyo sa table, makikita nyo yung glands. Tingnan nyo yung glands, di ba? Pinagpapawisan, naluluha, naglalaway. Kaya basa, tandaan nyo, basa pag exocrine. Okay? Next, meron din namang effect ang muscarinic 3 sa smooth muscles. Again, meron ding effect sa smooth muscles. Ang generalized effect ay contraction. Again, ang generalized effect ay contraction. Tandaan nyo yan ha, contraction din. Para maintindihan, i-discuss natin yung nasa table. Okay, i-discuss natin. Number one, in the eyes. Okay, in the eyes. So yung number one dito sa mata yan. Okay, yung sphincter muscle and ciliary muscles of the eyes. So since contraction ang mangyayari, the effect is meiosis. Okay, the effect is meiosis. Okay? Next, in the bronchi, since contraction niya ang reference natin, there is bronchoconstriction or bronchospasm. Moving on, in the GI tract, and in the urinary bladder. So again, yung susunod GI tract and urinary bladder, ang general effect lang din dito, contraction. Kaya in the GI tract, merong bowel movement. In the GI tract, merong bowel movement. Anong related term sa bowel movement? Is it constipation or diarrhea?
Diarrhea.
Yes. So diarrhea, muscarinic 3 siya. And then in the urinary bladder, there is urination. Okay? Again, in the urinary bladder, there is urination. So yun yung effect. So overall, makikita natin, ang epekto ay nagko-coincide pa rin sa general rule na contraction. Okay? Siya ay nagpa-follow pa rin sa general rule. Overall, guys, yan ang muscarinic receptors. Going back, we have muscarinic 1, we have muscarinic 2, and we have muscarinic 3 receptors. Now, drug application tayo. Okay, i-connect natin sa gamot. First question. If we want to employ an anti-asthma therapy, anong dapat gawin sa muscarinic 3 receptors? Ano ang dapat gawin sa muscarinic 3 receptors? I-activate or i-block?
Block.
Yes. Kaya kapag ang gamot ay muscarinic antagonist, anti-asthma yon. May anti-asthma. Do you get my point? Naintindihan? Yes. Okay, very good. If we want to counteract constipation, if we want to treat constipation that a patient has, what is the goal? Do we need to activate muscarinic or do we need to block muscarinic?
Activate.
Yes, activate. So dun maglalaro yung mga drug actions. They can either activate or block. Yan ang practicein nyo pag nag-aral kayo. Okay? Next, paano kapag may excessive sweating or lacrimation ang tao? What do we need to do? Activate or block muscarinic 3?
Block.
Yes, block. Very good. Next, if we want to counteract bradycardia, what are we going to do? Block or stimulate muscarinic 2?
Block.
Block. Very good. Okay, so it seems that you are learning. So thank you very much. Napakita ko to kahapon. Ang realization nyo sa table na to, ito yung mababaw, superficial effect. Ngayon, matitrace nyo anong receptor na ang dahilan. At napansin nyo siguro, nabanggit ko ba kahapon na ang para at ang simpa ay antagonistic with one another?
Yes.
Yes. Kaya pag nag-aral kayo sa mga bahay nyo, pag chinek nyo yung mga effects na yan, antagonistic sila, physiologically antagonistic because may mga receptors silang kinokontrol. So recap tayo, pag sabihin nyo kung para or simpa ha, kapag alpha at beta, para or simpa? Simpa ha,
Simpa po.
sympathetic yon. And then pag para, muscarinic and nicotinic. Okay? For the last slide, bago tayo mag-health break, siguro medyo puno na yung utak natin. Kaya pag natapos natin yung slide na to, health break na. Another, we have nicotinic receptors. So medyo mabilis lang ang nicotinic receptors. We have two types. Na-discuss ko to kahapon, nicotinic neural and then NM receptors. Regarding nicotinic neural, we can see nicotinic neural receptors in the adrenal medulla and also in the ganglion. Ay, in the ganglion. Na-mention ko siya kahapon. Ano yung effects sa adrenal medulla? Nase-secrete ang epinephrine and in some cases, norepinephrine. I think na-discuss ko ang regulation ng epinephrine secretion, di ba? Recall, acetylcholine has to bind to nicotinic receptors. That is nicotinic neural. Next, sa nicotinic M naman, this could be found in the neuromuscular junction or end plate. In short, ang effect dito, ito na lang yung tandaan nyo sa NM, ang effect ay skeletal muscle contraction. Okay, again, ang effect ay skeletal muscle contraction. I repeat, in the NM receptors, activation of NM receptors can cause skeletal muscle contraction. Okay, section C, these are the cholinergic receptors. Going back, na-discuss na natin ang mga receptors such as adrenergic and cholinergic receptors. And your learnings here will help you understand the next topic na i-discuss ko after the health break. Kasi puro drugs na ang i-discuss natin mamaya. Okay? And that finally ends part 1 of autonomic nervous system drugs. Guys, naintindihan ba yung first part?
Yes, sir.
Sir.
So, the second part of our lecture talks about adrenergic drugs. First stop, what's the importance of reviewing this? Actually, review na lang siya because you had this in Pharmacology 1. Mind you that majority, if not majority, karamihan sa mga gamot na ginagamit for cardiovascular diseases ay adrenergic agents. Kaya importanteng maintindihan nyo ito ulit. Kaya i-discuss natin siya. Basically, when we talk of adrenergic drugs, these are the agents that can alter the physiology of the sympathetic nervous system. Kaya nga adrenergic ang tawag. So basically, dalawa ang grupo ng gamot na i-discuss natin dito. Number 1 are the agonists. Okay, number 1 are the agonists. And then number 2, we will discuss antagonists. Okay, again, number 2, we will discuss the antagonists. So first stop, let's tackle the adrenergic agonist. And technically, these are termed as sympathomimetics. Okay, these are sympathomimetics. So when we say mimetic, pag sinabi nating mimetic, these are the agents that can mimic, these are the agents that can mimic the action of endogenous catecholamines like norepinephrine. They promote mimicry, of natural catecholamines like for instance norepinephrine. So what do we mean by mimicry? Gagayahin. Gagayahin nila yung epekto ng norepinephrine. Ano ba ang kayang gawin ng norepinephrine? It can either bind to alpha o kaya beta receptors. Therefore, kung ginagaya ng mga gamot ang effects ng norepi, yung natutunan nyo kanina sa previous presentation natin, ganon ang pwedeng mangyari. Okay, ganon ang pwedeng mangyari. It just depends kung anong receptor ang tatargetin. So yun yung i-discuss natin. We have two major classifications of sympathomimetics, and that is based on chemistry and also based on the MOA or mechanism of action. When we say based on chemistry, that tells something about the structure of the adrenergic agonist. We have catecholamines and non-catecholamines. Whereas for drugs or mimetics based on mechanism of action, we have direct acting, indirect acting, and mixed acting sympathomimetics. We will tackle them individually, starting off with based on chemistry. Let me reiterate that when we talk of based on chemistry, when we take a look in the chemical structure of a sympathomimetic, we can tell if it is a catecholamine or a non-catecholamine. First stop, paano natin masasabi based on structure ng isang mimetic ay catecholamine? Ang catecholamine na term ay derived sa dalawang salita. First, we have catechol, and second, we have the term amine. based on chemistry, pag sinabi natin catechol, that is a benzene ring. Ang structure niya ay benzene ring containing two hydroxyl groups that are orthopositioned. Okay? That are orthopositioned. Pag sinabi natin sa organic chem na orthoposition, how's the positioning? Is it magkatabi, magkatapat, or alternate?
Magkatapat po.
Ha? Ang magkatapat para position yon. Para,
Okay.
di ba?
Magkatabi, sir.
Magkatabi
Yes,
po.
magkatabi.
Magkatabi po.
Yes, magkatabi. Very good. So magkatabi siya. So halimbawa, 1 and then 2. So OH and then OH. Catechol yan. Okay? Catechol ang tawag dyan. Kapag magkatapat, para yun eh. At pag alternate, meta position. Di ba? Yan yung ibig sabihin ng catechol. Next, kapag amine naman, okay, again, kapag amine, merong amine functional group and that is ethylamine siya. Okay? Ethylamine group. Okay? Ethylamine group. And overall, when we say catecholamines, these have a nucleus containing phenylethylamine. Okay? Phenylethylamine nucleus. So ito yung structure na makikita natin for catecholamines. Wherein the benzene ring served as the substituent, kaya may phenyl tayo dyan, and then we have ethylamine, the amine group. Okay? Kaya when we say catecholamines, these are the ones that contain 3,4 dihydroxybenzene groups. Meaning to say, may catechol na orthoposition. Okay? 3 and 4, magkatabi sila. Okay? And in terms of their actions, take note that they have high potency in activating alpha and beta receptors. So again, they have high potency. So a higher chance that they can activate these receptors. And note that they are susceptible to MAO and COMT. So they are susceptible to the enzymes MAO and COMT. Now, what's the importance of telling you this? Mind you that enzymes MAO and COMT ay makikita sa ating liver. Okay? Makikita ito sa liver. So, if the drugs or catecholamines, pag pumasok sila sa liver, na metabolize agad ang mga catecholamines because of the presence of MAO and COMT. So, ang takeaway natin dyan, ang mga catecholamines in general, they are not administered by mouth. Okay? They are not administered by mouth. Di ba ang risk kapag ang gamot ay tinake by mouth, papasok siya ng liver and will undergo first pass effect. Natatandaan ba ang first pass effect?
Yes.
Okay.
Yes, sir.
So
Yes
that's
po.
why it is highly recommended that catecholamines should not be administered by mouth. Instead, ang mga suggested routes, they are designed to bypass the liver, such as intravenous, inhalational, o kaya subcutaneous administration. Okay? Such as intravenous, inhalational, and also subcutaneous. Okay? Next, they also have short duration of action. Okay? They also have short duration of action. And finally, they do not penetrate the brain or the CNS. Why? Okay? Bakit hindi sila nagpe-penetrate sa utak? Para ang gamot, nare-recall ito before, para ang gamot ay tanggapin ng brain, kailangan makadaan ang gamot sa tinatawag na blood-brain barrier. Okay? Para ultimately, the drug could reach the brain. However, ang catecholamines, hindi sila nakaka-pass through ng utak kasi ang catecholamines, they are polar. Okay? Because catecholamines are polar. Ang blood-brain barrier ay non-polar. Diba? Hydrophobic ang blood-brain barrier eh. So hindi sila parehas, kaya the blood-brain barrier will not permit catecholamines to enter. Kaya they do not penetrate the brain. Do you get it? Yung connection ng polar sa inability to penetrate?
Yes.
Yes,
Okay. So that's nice. Okay na tayo guys sa catecholamines. So nakilala nyo ang catecholamines, dapat pag nakita nyo ang structure, ganito siya. Okay? Mamaya may mga sample structures tayong papakita. What about for non-catecholamines? Basically, ang non-catecholamines, pag nawala ang kahit isang itsura sa phenylethylamine nucleus, hindi na siya catecholamines. And in terms of actions or properties, hindi siya na may metabolize ng MAO and COMT because of the absence of the catechol hydroxyl groups. Therefore, mape-permit ba ang by-mouth administration when we talk of non-catecholamines?
Yes.
Yes, so pwede siyang by mouth administered. Longer half-lives, kaya lesser frequency of administration. And ito nga nakalagay, administered orally. Okay, administered orally. And take note, there are some examples of non-catecholamines that can actually enter the brain. Okay, so meron din mga nag-act CNS or may centrally acting din. Unlike ng catecholamines, wala talaga. So in connection to that, let's have some examples. So number one are the catecholamines. O tignan mabuti ang structure ng catecholamines. Examples are dopamine, epinephrine, isoproterenol, norepinephrine, and dobutamine. You can see that for example kay norepinephrine, we have the catechol structure and ethylamine. Ethylamine means may amine group. At ethyl, ilang carbons pag ethyl? Dalawa. Kaya we have number 1 and then number 2. So, we have ethylamine. Okay? Ang epinephrine, same thing, 1, 2. And then isoproterenol, 1, 2. Dopamine, 1, 2. Not to mention na meron silang catechol ring structure. Okay? So, yan ang mga examples. Now, those that I will highlight red are natural. Dopamine, natural catecholamine siya. Epinephrine, natural catecholamine. And norepinephrine, they are natural catecholamines. When we say natural catecholamines, for everyone's enlightenment, these are self-made by the body. Kaya natin itong gawin. Okay? What about for isoproterenol, yellow, and then dobutamine, yellow? They are synthetic. So our body cannot produce them. But structure-wise, they are catecholamines. Okay? So yan ang mga catecholamines. Can we proceed to non-catecholamines?
Yes po.
Okay. So for non-catecholamines, they do not possess phenylethylamine group. For example, phenylephrine, pag-check nyo, kulang agad ang OH. Methoxamine, wala rin. Ephedrine, wala rin. Amphetamine, wala rin. So examples are phenylephrine, methoxamine, ephedrine, and amphetamine. Now, anong sabi natin? Pag non-catecholamines, do we permit by mouth administration? Yes or no?
Yes.
Yes. Kaya 'di ba ang phenylephrine ay kasali sa BioFlu. Okay? Kasali siya sa BioFlu sa NewZep, by mouth 'yon. Pwede siya. Okay? Pwede. And then amphetamine, pwede rin by mouth. Unlike nito, mga parenteral ito eh. Kay mga parenteral. Wala tayong by mouth na administration na mga yan. So gets niyo kung bakit iniiwasan ang liver. Iniiwasan ang enzyme sa liver. So altogether guys, that's the end of classifications based on chemistry. So based on chemistry, we have catecholamines and non-catecholamines. Moving on, let us have classifications of sympathomimetics based on the mechanism of action. Guys, we have 3 classifications. So number 1, we have direct acting, indirect acting, and finally we have mixed acting sympathomimetics. So what do we mean by these classifications? So meron tayong figure that would explain that later, but for the examples muna, take note of the following. Number 1, for direct acting, we have endogenous catecholamines, alpha and beta agonists, in which ang endogenous catecholamines, these are non-selective. Okay? These are non-selective direct-acting mimetics, whereas ang alpha at beta agonists, they are selective agents. Again, they are selective agents. So later, madidiscuss natin ng mas elaborate ang difference ng term na selective at non-selective. For indirect acting naman, we have releasers and reuptake inhibitors, which will be explained also later. And finally, mixed acting. When we say mixed acting, these are the agents that possess both direct and indirect actions. So pag nag-jive ito parehas, mixed acting na ang tawag. Okay, mixed acting na ang tawag. So explain natin kung ano ang mechanism of action nung tatlong classes. So first stop, we have direct acting sympathomimetics. Again, proceed tayo everyone sa direct acting. When we say direct acting mimetics, take note, these are the drugs that can directly bind and activate adrenergic receptors. So ito yung mga gamot na diretsyong pupunta, sila mismo ang pupunta sa receptor at sila mismo ang mag-activate. They do not need the natural norepinephrine to bind. Sila lang ayos na. Sila lang may sympathetic effect na. Okay? Ang tawag doon ay direct acting. Next, number 2 are the indirect acting mimetics. So when we say indirect acting mimetics, these are the drugs that can enhance sympathetic effects. Again, these agents can enhance sympathetic effects by enhancing the amount of natural norepinephrine available for binding. Again, pag sinabi nating indirect acting, these are the drugs that can enhance the level of natural norepinephrine in the synaptic cleft. So anong difference nito sa direct acting? Ulitin natin, anong difference nito sa direct acting? Ang direct acting, gamot mismo ang magbabind. So direct action siya. Pag indirect acting, hindi gamot ang pupunta sa receptor, kung hindi yung natural norepinephrine pa rin. Kaya lang, marami kaysa sa usual. Marami kaysa sa usual. Now, paano ma-achieve ang goal na maraming natural norepinephrine? Dalawa ang mechanisms leading to that. Number 1 is by enhancing exocytosis. Okay, again, number 1 is by enhancing exocytosis o kaya by preventing reuptake process. Again, that is by enhancing exocytosis, and another is by inhibiting or blocking reuptake mechanism. Are you still listening?
Yes,
sir.
Okay.
Yes.
Let's recall yung processes, exo and reuptake. Natatandaan ba ang exocytosis? This is the process of release, right? So pag-enhance ang release ng exocytosis, do you think na-achieve natin ang objective na enhanced natural norepi?
Yes.
Yes. So greater will be available for binding. Very good. Next, yung blockade of reuptake ba? By having this mechanism, do we achieve the objective of enhancing natural? Yes or no?
Yes.
Yes, okay. Kaya indirect acting, natural ang nagbabind. Kaya when we go back to the previous slide regarding indirect acting mimetics, meron tayong releasers at reuptake inhibitors. Sa releasers, ito yung nag-a-address ng enhancing exocytosis. Okay, ito yung nag-a-address ng enhanced exocytosis. Okay? So that is for indirect acting. And then finally, we have mixed acting. You can see that in the mixed acting portion, may nakaturo sa exocytosis part at may nakaturo sa direct action kasi combination to ng direct at indirect action. Okay? So combination ito ng direct action at indirect action. So based on MOA, these are the classifications of sympathomimetics. Guys, naintindihan ang MOA?
Yes, sir.
Okay. Single question about the MOA. Ano ang ultimate goal ng lahat ng mga mechanisms na to? Ang goal ba natin is to enhance sympathetic or reduce sympathetic effect?
Enhance.
Enhance. Lahat to enhancers kasi nga mimetics ang pinag-uusapan natin. So ngayon, let's proceed to direct acting adrenergic agonists. So for direct acting sympathomimetics, I repeat, we have two types based on selectivity of action. Again, meron tayong dalawang klase ng direct acting based on selectivity of action. Number 1, we have the non-selective. Number 1 are the non-selective direct acting mimetics, and second, we have the selective direct acting mimetics. Question, what is meant by the term selectivity of action? Makakategorize natin ang sympathomimetics kung sila ba ay maarte sa receptors o hindi sila maarte. Kapag ang sympathomimetic ay hindi maarte sa receptor, non-selective yon. Ibig sabihin, ang pinupuntahan ng gamot ay more than one general type ng adrenergic receptors. So pwedeng alpha, again, more than one general type, burahin natin, more than one general type of adrenergic receptors. So dapat kasali dito ang alpha, beta, and at some extent, dopaminergic receptors. So dapat more than one. Pag sinabing more than one, pwedeng alpha at beta, pwedeng alpha, beta, dopa, but never alpha alone, never beta alone, never dopa alone. Okay? Kaya hindi sila maarte, non-selective. Next, pag selective naman, only one general type, only one general type of sympathetic receptors. Like for instance, kung loyal sa alpha, alpha lang dapat. Pag beta, loyal lang sa beta. At kung dopaminergic lang, loyal lang din sa dopaminergic receptors. Okay? Kaya selective ang tawag doon. So yan ang classifications ng sympathomimetic agents, direct acting. So first stop, discuss natin ang mga non-selective direct acting mimetics. O recall, pag non-selective, only one or more than one?
More than
More
one.
than
Okay,
one.
more than one general type. Kaya ang example natin dito are the natural catecholamines. So remembering natural catecholamines or endogenous catecholamines, we have three examples. Ang palatandaan doon, everyone ay NED. Okay, ang palatandaan ay NED. Norepinephrine, epinephrine, and also we have dopamine. Kaya makikita natin sa mga receptor targets ng tatlong gamot na to, ay makikita natin sa receptor targets, marami silang tinatarget na sympathetic receptors. For example, kay epinephrine. By the way, epinephrine is also known as adrenaline. Okay, it is also known as adrenaline. Ang target ng epinephrine are the following receptors. So tandaan, meron siyang target sa beta 1, may target din siya sa beta 2, and also alpha 1 receptors. Again, ang target ng epinephrine ay beta 1, beta 2, alpha 1. As you can see, both beta and alpha are being targeted, so non-selective siya. Okay? But it is interesting to note that epinephrine does not target alpha 2. So wala siyang target. Sa alpha 2, beta lang, 1 and 2, and then alpha 1 lang. That's for epinephrine. Next, for norepinephrine naman, this is also known as noradrenaline and levoterenol. AKA lang yan. For norepinephrine naman, everyone, for norepinephrine, it targets beta 1 and alpha 1. Okay? It targets beta 1 and alpha 1. So yung data na nakalagay dyan na little effect on beta 2, somehow, it was compared to epinephrine. It was compared to epinephrine. As manifested, epinephrine as compared to norepinephrine can target beta 2. Okay? It can target beta 2. Nagets ba yung sinasabi ko?
Yes po.
Okay, so good. Next, for dopamine naman, ang distinct kay dopamine, it targets all. Dopamine 1, beta 1, alpha 1. Okay, it targets all. So we have dopamine 1, beta 1, and also alpha 1 receptors. So yan ang mga natural or endogenous catecholamines. They are non-selective. It's more than one general type. Guys, advice ko sa inyo or tip ko sa inyo, bilang teacher, whenever I say receptor targets, dapat nagbiblink na, nare-refresh na sa utak nyo kung ano ang effect ng mga receptors na yan kasi may clinical relevance yan. Magbibigay ako representative example. Nakita nyo na majority nung, or not majority, lahat ng mga natural catecholamines, they target what? Beta 1. They target beta 1. So you can expect that these drugs are cardiac acting. Tama ba ako? They are cardiac acting. Tama ba?
Yes po.
Yes. So, ganun ang gagawin nyo. I-connect nyo siya agad dun sa diniscuss ko sa receptors. Okay? What else? Nakita rin natin dito na sa tatlong catecholamines, si epinephrine lang ang nagbabind sa beta-2. So, sa tatlong catecholamines, ang pwede mong gamitin sa mga taong may bronchoconstriction or difficulty of breathing, lalo na pag emergency, epinephrine. Okay, epinephrine. Kaya 'di ba ginagamit siya for anaphylaxis kasi may difficulty of breathing sa anaphylaxis. Next. Okay? Pwede na tayo mag-proceed sa slide na to.
Yes, sir.
Okay. Pakibago yung title, it must be selective. Okay? Pakibura yung prefix na non. So next, we have selective direct-acting mimetics. These are the alpha and also beta agonists. So this figure summarizes the mechanisms of alpha and beta agonists. Kaya sila selective because they only target either alpha or beta receptors. For example, for alpha-2 agonists, remember, alpha-2 receptors are presynaptically located. That's why they can usually target, or sorry, not block, they can activate presynaptic alpha-2 receptors. They can activate presynaptic alpha-2 receptors. Next, for alpha-1 naman, alpha-1 agonists can target postsynaptic alpha-1 receptors, while for beta agonists, beta-1, 2, and 3, they can activate beta receptors. Direct acting sila, pero selective kasi chosen lang ang pinupuntahan nila. Okay? So yan yung ibig sabihin natin ng selective direct acting. Now, na-discuss ko na to actually sa inyo. Note everyone that for direct acting mimetics, since they can directly bind and activate sympathetic receptors, they can mimic the action of norepinephrine in the body. So lahat ng na-discuss natin mga effects last time, ia-apply lang natin dito. And it is based on formation of secondary messengers. Okay? So that is based on formation of secondary messengers. So for example, in this table, na-explain ko na karamihan dito, dadagdagan na lang natin. Yung radial muscles, alpha-1 tayo, alpha-1. Ang general effect ng alpha-1 ay contract, di ba? Contract. So na-discuss ko na ang iris kanina, ang arteries na-discuss ko na, ang sphincter na-discuss ko na rin. Huy, tama ba ako? Na-discuss ko na to sa alpha-1?
Yes, sir.
Yes.
Sir.
And then pilomotor, sa pilomotor, yes, na-discuss ko na rin. And then, yung seminal lang ay hindi ko na-discuss, but the effect is ejaculation. Ejaculation. And then in the liver, the effects are glycogenolysis. So nabe-breakdown ang glycogen and nafo-form ang glucose. Okay, nafo-form ang glucose from non-carbohydrate sources. Next, ang alpha-2, pag presynaptic, na-discuss ko na din siya, inhibits norepinephrine release. In the platelets, additionally, there is aggregation. And in the pancreas, I told you it's hyperglycemia because of inhibition of insulin release. Next, proceed naman tayo guys sa beta 1 or beta receptors in general. Na-discuss ko na to lahat. You can check them out. Next, beta 2 in the blood vessels. Pero anong sabi natin? Anong klaseng blood vessel ang tinutukoy sa beta 2? Yun nasa cardiac or skeletal muscles?
Skeletal.
Okay, sa skeletal. Skeletal. Okay, skeletal muscles. Okay? Yung ugat sa skeletal muscles. And then sa bronchi, na-discuss na rin natin siya. Puro dilation as you can see. And then uterine smooth muscles, skeletal muscles. Ito yung sinabi ko na uptake of potassium. Ibig sabihin, from the blood, pupunta ang potassium sa skeletal muscle. Therefore, anong mangyayari sa blood potassium? Tataas or bababa pag lumipat sa skeletal muscle?
Bababa.
Bababa. Kaya what did I tell you earlier? Ano pang effect ng beta-2? Hypo o hyperkalemia?
Hypokalemia.
Hypo. Very good. And then adipose lipolysis for beta-3. So actually, na-discuss ko na siya lahat kanina. Okay? Now, proceed tayo sa mga specific examples o dito na papasok ang pag-memorize nyo ng mga drug names. So sa mga examples natin ng mga agonists or mga selective mimetics, unahin natin ang mga alpha receptor agonists. First stop are the alpha-1 selective. Examples are phenylephrine, methoxamine, propihexadrine, tetrahydrozoline, oxymetazoline, and also nafazoline. So yan yung mga examples natin ng alpha-1 selective agonist. Okay? Ano ang general concept for alpha-1 selective agonists? Are they constrictors or dilator drugs? Ang alpha-1 agonist, sila ba ay constrictors or dilators?
Constrictor.
Okay. Pag sinabing constrictor, nagko-contract. Kasi basically, they support alpha-1 effect. Okay? So they are constrictors. That's good. Next, we also have alpha-2 selective agonists. Okay? So again, they are selective alpha-2 agonists. So when we talk of selective alpha-2 agonists, these are clonidine, methyl-dopa, guanfacine, guanabens, apraclonidine, and brimonidine. The major difference ng mga gamot na naka-bracket is that for the first group, clonidine until guanabens, they target the presynaptic alpha-2 receptors. So they activate presynaptic alpha-2 receptors, whereas ang apraclonidine and brimonidine, more of postsynaptic alpha-2 ang tinatarget nila. So they usually target postsynaptic alpha-2 receptors. You will further understand them pag nag-discuss tayo ng clinical uses nila. Okay? So sort of memorization to mga drug names. So we have clonidine, methyl-dopa, guanfacine, guanabens, apraclonidine, and brimonidine. Moving on are the beta agonists. Okay? Beta agonists. So regarding beta agonists, guys, we have several agents. Number one, for non-selective beta agonists, this is isoproterenol. Isoproterenol can activate both beta-1 and beta-2 receptors. Okay? It can activate beta-1 and beta-2 receptors. So example is isoproterenol, also known as isoprenaline. Question. Again, question. Anong klaseng direct mimetic ang isoproterenol? Again, anong klaseng direct acting siya? Is it selective or non-selective?
Non-select.
Selective or non-selective? S or N?
N.
Okay. Balikan natin ang slide na to. Paano nyo malalaman pag selective at non-selective? Pag more than one, non-selective. Pag only one, selective. Pero naka-emphasize general type. Dapat magfo-fall pa rin siya sa iisang umbrella na puro alpha, na puro beta, na puro dopa. So halimbawa kay isoproterenol, ang isoproterenol, oo, non-selective siya sa beta, pero at the end of the day, it falls under one umbrella, beta receptor. Kaya selective siya. Naintindihan?
Yes, sir.
Okay, so
Yes.
selective siya rather. Selective siya. Tandaan nyo yan ha. Selective mimetic siya. Pero pag tinanong anong klaseng beta agonist siya, pag in-specify kung anong klaseng beta agonist, saka nyo sasabihin non-selective. Pero pag tinanong kayo anong klaseng mimetic siya, selective mimetic siya. Okay, so yun yung tatandaan. Example naman ng beta-1 selective agonist is dobutamine. And for beta-2, medyo marami tayong examples like albuterol, also known as salbutamol, metaproterenol, terbutaline, and pirbuterol. These agents up until pirbuterol are SABAs. Okay, these are SABAs. When we say SABAs, ang ibig sabihin ng SABAs ay short-acting beta agonists. Okay, so these are short-acting beta agonists. Whereas salmeterol, formoterol, indacaterol, and also bambuterol, these agents are labas. These agents are labas. Again, for salmeterol, formoterol, indacaterol, and bambuterol, these are labas or long-acting beta agonists. Okay? So usually these drugs, the SABAs and LABAs, are bronchodilators. Okay, these are bronchodilators. Okay, these are bronchodilators. We have SABAs and LABAs, the short and the long-acting agents respectively. Now, additionally, meron pa, sa beta-2 selective agonist, meron tayong mga gamot called as tocolytics. Okay? Meron din tayo mga gamot called as tocolytics. So examples of tocolytics are ritodrine. Again, examples are ritodrine and also isoxsuprine. Again, examples of tocolytics are ritodrine, and aside from ritodrine, another we have isoxsuprine. So yan yung mga tocolytics. Beta-2 agonists din sila. So these are the beta agonists. Next, for dopamine naman, dopamine agonist, isa lang ang example natin ng dopamine agonist, and that is phenoldopam. Okay, again, the example, dopamine 1 agonist, we have phenoldopam. As you can see, it activates dopamine 1 receptors, kaya ang effect niya ay renal vasodilation. So ang effect ng phenoldopam is renal vasodilation. So due to renal vasodilation caused by phenoldopam, there is enhanced glomerular filtration rate, and therefore diuresis. Okay, so activation of D1 receptors can cause renal vasodilation, thus increasing glomerular filtration rate, and then ultimately causing diuresis. Okay, so these are the selective direct-acting mimetics. So para hindi kayo malito, balikan natin siya briefly. So going back to direct-acting mimetics, we only have two classes. Number one are the non-selective agents and then selective. Kapag non-selective, yung NED lang yon, norepinephrine, epinephrine, and dopamine. Pag naman selective agent, iisa-isahin nyo siya. Those that target alpha receptors. Di ba under alpha, meron tayong alpha 1 agonist and then meron tayong alpha 2 agonist. And then, sa beta, meron din sa beta. Diniscuss natin ang beta 1, may beta 1 agonist and then beta 2 agonist. And then finally, dopamine agonist. So lahat yan ay nag-e-encompass sa direct-acting mimetics. Okay? So lahat yan ay nag-e-encompass sa direct-acting. Nandyan pa kayo? Malapit na matapos ang oras, hindi yung lesson. Nandyan pa? Ha? Okay pa kayo? Sige.
Yes, sir.
So mukhang hindi i-post ko muna yung moving forward. Second group of sympathomimetics are indirect acting agents. Anong sabi natin for indirect acting? Ano ang nagbabind sa receptors? Yung drugs ba or natural norepi?
Natural.
Yes, very good. Natural. Ano yung dalawang means to achieve that? Number one, paramihin ang exocytosis or labas. Pangalawa, i-block ang reuptake process. So ang tawag natin sa nag-e-enhance ng exocytosis, are the releasers. Okay, these are the releasers. Well, actually, yung term na releasers, ito rin yung binanggit ko last time or kanina na T. Naalala niyo yung T? Yung T na palatandaan. Dinagdagan lang dito. Okay? So examples, okay, very good. Examples are tyramine. Okay, tyramine, idagdag nyo ang ephedrine dyan. Kasali ang ephedrine. Okay, ephedrine. And also we have amphetamine. Okay, amphetamine. And you can see na merong derivatives ang amphetamine na releaser din, like methamphetamine. Ang methamphetamine is shabu. Okay? Yan ang chemical name ng shabu. And then we have phenmetrazine, methylphenidate, and modafinil. So these are releasers, as we tell. Next, the uses of these drugs will be discussed tomorrow. Next are the reuptake inhibitors. Examples are cocaine, atomoxetine, reboxetine, and also sibutramine. So these are reuptake inhibitors. Okay? So yung mga clinical uses nga, as we mentioned, madidiscuss next meeting. And then finally, mixed acting. I told you that they act both direct and indirect. So parehas sila nagbabind sa receptors at may indirect action. Usually, ang indirect action nila ay by enhancing exocytosis. Okay? By enhancing exocytosis. So examples are ephedrine, included din dito. So pag naka-encounter kayo ng question, pag tinanong kung anong classification ng ephedrine, pag nasa choices, parehas ang indirect at mixed acting, the best answer is mixed acting. Okay? Kasi nabanggit natin ngayon na may direct action din siya. So mixed acting. Pero pag absent ang either of the two, o pili kayo kung alin ang nararapat. So pag indirect lang ang nakita, edi indirect ang isasagot. Okay? O kaya halimbawa ang question, Morse type. Halimbawa Morse type. Ang question is, which of the following are members of indirect acting? And nasa Roman numeral 1 ang ephedrine. Isasama mo ba siya? Yes, isasama mo siya. Kasi may indirect action siya. Don't forget that. Okay? Examples are ephedrine, pseudoephedrine, and aside from pseudoephedrine, we have mephentermine and phenylpropanolamine. Regarding ephedrine, delikadong gamot ang ephedrine kasi most of its adverse effects are associated with cardiovascular symptoms. Okay? Cardiovascular symptoms that could be deadly. Next, ang pseudoephedrine naman, this is actually a precursor in shabu synthesis, okay? In the formation of shabu. So pag magmamanufacture ng shabu, isang ingredient needed is pseudoephedrine. Examples of mixed acting are ephedrine, pseudoephedrine, and mephentermine and phenylpropanolamine. So overall, these are the specific